Welcome to the training hosted by Javier Carrasco. The training will focus on Fitnessgram is a fitness assessment and reporting program for youth first developed in 1982 by the Cooper Institute in response to the need for a comprehensive set of assessment procedures in physical education programs. According to the Texas Education Code 38.101, a school district annually shall assess the physical fitness of students enrolled in grades 3 through 12. Fitnessgram is a health-related physical fitness assessment. Each of the test items were selected to assess important aspects of a student's health-related fitness, not skill or agility. Students are compared not to each other, but to health fitness standards, carefully established for each age and gender that indicate good health. Students should learn to self-assess their fitness levels and interpret the results. This will help them learn about fitness concepts, plan and set goals for fitness, and serve as a motivational tool to remain active on their own. So what fitness areas do the Fitnessgram activities assess? Fitnessgram assesses aerobic capacity, body composition, muscular strength, endurance, and flexibility. Aerobic capacity is perhaps the most important component of any fitness program. Research indicates that acceptable levels of aerobic capacity are associated with a reduced risk of high blood pressure, coronary heart disease, obesity, diabetes, some forms of cancer, and other health problems. The Fitnessgram program provides 3 field tests of aerobic capacity: the PACER test, 1 mile run or walk, and walk test. The PACER, the Progressive Aerobic Cardiovascular Endurance Run, is the default aerobic capacity test in Fitnessgram. It is a multi-stage fitness test adapted from the 20-meter shuttle run test published by Leger and Lambert in 1982. The test is progressive in intensity, it's easy at the beginning, and gets more difficult at the end. The progressive nature of the test provides a built-in warm-up and helps children to pace themselves. The test has also been set to music to create a valid, fun alternative to the customary distance run test for measuring aerobic capacity. The PACER test is recommended for all ages, but its use is strongly recommended for participants in grades K through 3. The PACER is recommended for a number of reasons, including the following. All students are more likely to have a positive experience in performing the PACER. The PACER test helps students learn the skill of pacing, and students who have a poor performance will finish first and not be subjected to the embarrassment of being the last person to complete the test. Body composition refers to the division of total body weight into components, most commonly fat mass and fat-free mass. The proportion of total body weight that is fat, referred to as percent body fat, is an important health-related indicator because high levels of body fatness are associated with increased risk of coronary heart disease, stroke, and diabetes. Body composition standards have been established for both percent body fat calculated from triceps and calf skin fold measurements, and for BMI calculated for measurements of weight and height. The body mass index, or BMI, provides an indication of the appropriateness of a child's weight relative to height. Height and weight measures can be entered into the software in pounds and inches, but they are converted to metric units by the computer to calculate BMI. To obtain accurate data on height and weight, it's important to measure children without their shoes on. Shoes can be heavy and can also increase a person's height. Therefore, use this procedure for all measurements. In measuring height and weight, you are encouraged to drop fractions of an inch or a pound and use the lower whole number. For the curl-up test, the students complete as many curl-ups as they can at a specified pace. Maximum is 75. The curl-up has been selected because it does not involve the assistance of the hip flexor muscles and minimizes compression in the spine when compared to a full sit-up, with the feet held. Strength and endurance of the abdominals are important in promoting good posture and correct pelvic alignment. A test of trunk extensor strength and flexibility is also included in Fitnessgram because of its relationship to low back health, especially proper vertebral alignment. The movement should be performed in a slow and controlled manner. The maximum score on this test is 12 inches. While some flexibility is important, it's not advisable to encourage hyperextension. For the trunk lift test, students lie prone with their hands under their thighs. The student lifts the upper body off the floor in a slow, controlled movement to a maximum of 12 inches. The 90-degree push-up to an elbow angle of 90 degrees is the recommended test for upper body strength and endurance. Test administration requires little or no equipment, and multiple students may be tested at one time. This test also teaches students an activity that can be used throughout the life as a conditioning activity, as well as in self-testing. Maintaining adequate joint flexibility is important to functional health. The back saver sit and reach is very similar to the traditional sit and reach, except that the measurement is performed on one side at a time. By testing one leg at a time, a determination can be made of any asymmetry in hamstring flexibility, and hyperextension of both knees is avoided. The sit and reach measures predominantly the flexibility of the hamstring muscles. The aerobic fitness standards in Fitnessgram, healthy fitness zones, establish 3 zones based on potential risks for future health problems. Attaining the healthy fitness zone for a test indicates that the child has a sufficient fitness level to provide important health benefits. The needs improvement zone should be interpreted as an indication that the child may be at risk if that level of fitness stays the same over time. For the body composition item, a third very low area is designated within the healthy fitness zone. Scores falling in this area deserve special attention to determine why the student's score is very low. The healthy fitness zone were established by determining the level of fitness required for a low risk for future health problems. For a detailed review on testing protocols, please view this link, which will provide you an overview of protocols utilized by the California Department of Education for each Fitnessgram assessment.